Hello and good afternoon, everyone, and thank you for joining us today for the webinar on how to leverage the EU Council conclusions on cardiovascular health. I appreciate that this might be a long weekend for some of you in some of the European countries. I am therefore grateful for making the time to join us. This session is brought to you by the FH Europe Foundation in collaboration with our partners across the EACH Alliance, the European Alliance for Cardiovascular Health. I'm Magdalena Koch, I'm CEO of FH Europe Foundation, and I will be your moderator today. The goal of this webinar is very simple. It's to help you understand what the Council conclusions are, why they matter, and how you, as an individual, organization, whether a patient or a scientific society, can take action in your own context. We will hear from three excellent speakers, and we have a bit of a twist, a bit of a surprise today, and I shall say women's power on the panel. And they represent both the policy, scientific, and patient advocacy landscapes. Don't worry, you don't need to be a policy expert to make a difference, and I believe we will help you understand how to do that. So let's start with a quick round of introductions. I take the liberty to introduce our fantastic panelists. I'm delighted to be joined today by Mrs. Kitty Almer, Public Health Attaché, Permanent Representation of Hungary to the EU, and at the same time, Chair of the Council Conclusions Group. We're delighted to have you with us, Kitty. Second on the panel is Mrs. Aoife Delmas, Chief Development Officer from the European Society of Cardiology. And Aoife, thank you so much for stepping for James, who unfortunately couldn't join us today. I'm delighted that you are making yourself available. Thank you. And last but not least, we have with us Ms. Joanna Tenkate, Patient Community Development Lead from our very good friend Global Heart Hub. And that's the panelists. I'm super excited that you are with us, ladies. But before we get into the gist of this particular webinar, I thought it would be helpful to understand who you are. So let's give you an opportunity to introduce yourselves. We have prepared a very simple survey by using Mentimeter. You can scan the QR code, and then by using the code number, enter the specific survey. It is also now being shared with you in the chat. In that specific survey, we have 3 questions for you. We're trying to understand where you're joining us from, if you can put your country. Second question is if you represent an organization that is a partner of the European Alliance for Cardiovascular Health, and if yes, please put the name of the organization, and if not, you can just simply put not relevant or skip the answer. And finally, most importantly, we would like to understand how familiar you feel with the Council conclusions. Each of the questions will be open for 1 minute, so don't worry. Our team behind the scenes will help advance those questions. And while you do that, I just thought I will take the opportunity to explain a little bit about FH Europe Foundation. I had some slides prepared for you, but for the sake of not messing around with the Mentimeter, I will not share slides, but very quickly walk you through the organization. So FH Europe Foundation is a network of patient organizations in familial hyperlipidemias. So under our scope, we have well-known familial hypercholesterolemia, their very common form, and their rare form, homozygous FH. We also advocate on behalf of people with elevated lipoprotein A and another rare condition called familial chylomicronemia syndrome. Collectively, we represent a group of 1.4 billion people around the world with those genetic inherited CVD risk factors. Our network consists of 34 patient organizations across wider Europe, and now, obviously, with Global Heart Hub, we say we are very much international. Lastly, we are a proud member, proud partner of the European Alliance for Cardiovascular Health. With that, I hope it has given you a little bit of time to respond to the Mentimeter survey. And I was just wondering if our team can now share the results on screen. One more to go. Fantastic. Well, that would force me to speak more about FH Europe Foundation, but I don't necessarily want to do that. So I'll take this opportunity to speak very quickly about each. And Aoife, you are wearing two hats today, representing European Alliance for Cardiovascular Health, as well as European Society of Cardiology. If you can maybe just help us understand briefly what each is, and then we will go back to the survey.
Yes, Magdalena, thank you very much, and welcome everybody to this webinar. I'm representing, as Magdalena has pointed out, the European Alliance for Cardiovascular Health, which is an alliance of over 21 partners calling for change in cardiovascular health across policies. We represent patient organisations, medical societies, industry partners and other areas and other organisations very much focused on the need for change in cardiovascular health and policies. It is a very active alliance, and I think obviously has encouraging results working with EU institutions to date.
Absolutely. And I think what might be worth sharing is part of our work is to activate an MEP group. If you can take maybe a minute to help our audience understand a little bit about that.
Yes, we very recently activated an MEP, a dedicated MEP group in cardiovascular health, and we're very thankful to all of the MEPs that have signed up to this. We had our launch a number of weeks ago in Brussels. We're very supportive of this group, and we are expecting that this group will quickly grow and will be supportive of any changes that we'll be looking to implement on a policy level.
Fantastic. Thank you so much, Aoife. And I will go back to our team behind the scenes to get an update on the survey. In the meantime, I can see that the chat is heated up. We have a lot of friends and colleagues present. Okay, they're coming up. Fantastic. So already now we can see that FH Europe Foundation is a country. No, that's a joke. We actually have a well-represented community from across Europe, but also other countries outside of the European Union. And I think what might be useful for everyone to understand that even though this particular event talks about EU Council conclusions, it could be a fantastic inspiration and motivation for other countries and other regions to take action. So Belgium, very well represented, Hungary, Sweden, Netherlands. We have as well people joining us from Iraq, Lebanon, Pakistan, United Kingdom. Have I missed anyone else? Luxembourg, Bulgaria, Spain, Estonia, Scotland, very proudly representing it as an independent country. That's great. Well, thank you. Let's move to the next question, please. Okay, which each partner are you affiliated with? So Global Heart Hub, FH Europe Foundation, Swedish Heart Lung Association, European Heart Network, and the European Society of Cardiology. Quick question, Aoife. Swedish Heart Lung is not necessarily a partner of each, but is probably a partner of an affiliated group.
Of the EHN, I believe, of the European Heart Network, huh? Yes,
fantastic.
Foundations.
Great. Well, lovely to see you all, and I'm glad that we have a diverse group on this webinar. And lastly, help us understand how familiar you feel with the Council conclusions. Okay, well, I am surprised that everybody is very familiar with that, which is a great point here because it makes probably your job, Kitty, a lot easier. But there are still some people who there is a disparity, and I just realized that we have maybe could have done it in percentages to understand better. But I think we know that there is a roughly well-informed group about the Council conclusions. Oh, the not at all are feeling now comfortable to say that maybe not at all. Well, listen, what matters now is really to address this assuming that there are people who know a little bit, there are some who don't know anything, and I guess this is a fantastic opportunity how we can even up the playing field. Great, wonderful. With that, I would like to invite you again, Aoife, to help us set the scene. To open this discussion, we've mentioned you wear two hats. You represent each an ESC, and probably that gives you a in a great place to speak briefly about the burden of cardiovascular disease across Europe. And more importantly, I would love to invite you to explain to all of us why now is such a critical moment for action. Aoife, the floor is yours.
Thank you very much, Magda. So yes, thank you very much for this opportunity to discuss with you the evidence in and around the need for prioritisation of cardiovascular disease. I'll do my very best to represent what is over 100,000 cardiovascular professionals from ESC and some of the work that we've been doing with each. And I'm delighted to have other partners as well, FH Europe and Global Heart Hub as members of the European Alliance for Cardiovascular Health to engage in this conversation. So the members of each have been calling for change and for policy change and attention in terms of cardiovascular health now for the last 3 years. And we're very much encouraged by the work that's ongoing and the responses by EU institutions, particularly that of the EU Council. And we'll have the opportunity with Kitty to discuss the conclusions that were decided last December and that were voted for very much we see this real opportunity to be able to turn around the tide and the burden of cardiovascular disease through policy change. The evidence is clear, but we have an opportunity today to speak about the evidence. The unbearable burden of cardiovascular disease for patients, people, health systems, etc., will only increase if we do not make change and policy change. And that very much is becoming clear in terms of the different figures that we have available to us. So ESC, along with other EACH partners, are very much committed to the fact that political change and policy change needs also to be anchored in evidence. And we invest a huge amount of our efforts through our national members and through our institutions to be able to follow the disease and look at the opportunity for change in terms of modelling with regards to different populations, etc. So just some areas, numbers are numbers, we all know that, but at the EACH level, numbers are also a response and are also reflective of individual personal stories. And the figures in themselves are startling and they make clear the need for action and urgent action, as Magdalena has pointed out. 34% of all deaths in the EU are caused by cardiovascular disease. That's huge in itself. 37% of them are for women and 31% are for men. More than 1 in every 3 deaths can be accounted for cardiovascular disease. And I think obviously a phrase that potentially becomes overused, but I think that should speak to everybody here on this call, to our family and friends, is that CVD remains the #1 killer in the EU and needs policy response that obviously reflects that fact that it is a #1 killer. It accounts for almost 5,000 deaths every day. So once we finish our day today, we know that 5,000 people across the European Union will unfortunately have died from cardiovascular disease. And many of those deaths we know are preventable in themselves. 62 million people live. So beyond those deaths, 62 million people are currently living with cardiovascular disease and the complications and the burden that represents in itself. I think one very important thing to bring forward as well is that there's a certain perception around cardiovascular disease, is that cardiovascular disease is sometimes seen as an old person's disease. And I think it's extremely important to point out that the figures show that this is the contrary. It heavily impacts people of all age groups. Around 20% of premature deaths, that's those premature deaths being the definition of under 65 in the EU, are caused by cardiovascular deaths. So it's also part of our work in terms of the European Alliance for Cardiovascular Health to turn around that misperception as well in terms of cardiovascular disease being an old person's disease. It is a disease that affects across all age groups, and obviously that points to the need for equalities and for being able to address cardiovascular disease across all age groups in itself. I also think that aspect of age points to the fact as well that the risk and prevalence of cardiovascular disease increases further with age. That's a fact. And this is of relevance to the Europeans' ageing population. We know that by 2040, 155 million Europeans will be over 65. therefore without decisive action today. So that again points to the need for urgent action. If we do not take action by 2040, those 155 million, the number of citizens suffering from cardiovascular disease and the burden of dealing with cardiovascular disease will increase dramatically. So that will have a huge effect on individual countries and citizens across the European Union, and points to that need for urgent action in itself as well. It's also important to point out, I think, that cardiovascular disease is often triggered as well by other chronic conditions in terms of diabetes, hypertension, chronic kidney disease, pulmonary disease, and cancer. So timely identification and working with other organisations dealing with appropriate management of comorbidities is essential to combat cardiovascular disease and to reduce healthcare costs. And the European Alliance of Cardiovascular Health is committed to working on that and building evidence in and around comorbidities and looking at the area of prevention. Great to see this panel today of female presenters. I also think that is also extremely important in the area of cardiovascular disease. To date, there is a mischaracterization of the risk of cardiovascular disease to women as being low, while in the contrary, more women die of heart attacks than men. So this belief is dangerous in itself, and it must be addressed as it is pervasive across how we deal with women and how we deal with cardiovascular disease and the opportunity for prevention, etc., in terms of policies moving forward. Reducing inequalities, to maybe answer Magda's question in terms of why action now. I think that reducing inequalities is at the heart of EU action. This is something that has been very much put forward by parliamentarians and members of the EU Parliament and Council, etc. But this is far from being achieved in terms of cardiovascular disease today. There's huge inequalities. We started here today by looking at the representation of the different countries and the different people on the webinar. But huge inequalities exist in terms of access to appropriate cardiovascular care, depending where you come from and depending on where you live in the European Union. That is not acceptable, and is a commitment, I think, as well from the EU to reduce these inequalities with regards to cardiovascular health and health in itself moving forward can be a motor and a vector for change and for improving equalities. And then maybe lastly, we'll speak a little bit about the cost of cardiovascular disease. Cardiovascular disease costs the EU 282 billion per year due to direct healthcare costs, productivity losses, and informal care by caregivers themselves. That's equal to 20% of all the healthcare expenditure of the EU. So obviously, any action that we can take in policy that is about reducing that burden gives the opportunity for building a stronger union, and therefore builds the need as well for urgent action in this area. So Magda, I hope that gives some aspects of setting the scene. It doesn't give all of the figures, but hopefully gives a quick summary to start us all off.
Thank you, Aoife. I hope everyone on this webinar was able to understand the public health, not only emergency, but also size. I still still meet a lot of clinicians in my day-to-day practice, as well as people in the street in Switzerland when I live, and they are very surprised that cardiovascular disease is #1 reason for death in Europe as well as in the world. And we have a lot of people from around the world joining this webinar. So the knowledge is among general public surprisingly maybe not as big as I would hope. So you giving this set of numbers across different, looking at cardiovascular disease from a different perspective, hopefully resonates with the audience and helps understand how important it is to take action and how important it is not to wait any longer. And I don't think we have been waiting. It's taken us many years to get policymakers and politicians to realize how urgent this issue is. And I hope that today we will also empower our respective members and organizations within wider community to act. And with that, I would like to bring now Mrs. Kitty Almer. Kitty, I could not be happier to have you on our panel, because there is probably no better person, I shall say, in Europe today who knows exactly what council conclusions are, how they're being created, and who can help us break them down one by one and understand how we can leverage them depending on which stakeholder group we represent for this collective action. Because I think what is important to say, and Eva, I hope you will support me in saying this, it's about collective action here under the umbrella of cardiovascular health prevention and everything that can happen as a result of what we do now. So Kitty, the floor is yours. I know you have some slides with you. We look forward to hearing from you.
Thank you very much, Magda, and also welcome everyone this afternoon, and thank you for joining this webinar. I am honored to be invited into this panel, and I am very happy that this set of council conclusions will not remain one in the drawers, but we can actually talk about it and leverage it. What I can say as an introduction to my council conclusion presentation is that everything that Eva was explaining beforehand, how much of a burden it actually means on patients, communities, and on actual governments, cardiovascular diseases, is that we heard it. During the Hungarian presidency, we heard these problems and we wanted to solve it. As far as I'm actually educated, there hasn't been another council conclusion very specifically on cardiovascular health in the last 20 years. So what we say is that we wanted to be pioneers in this. It was a very intense set of negotiations what we had to go through, but I'm very, very happy of the end results that we've got. And allow me to share my screen and walk you through my presentation in explaining how council conclusions work, and I hope that everyone can see it right now. The council conclusions is actually titled as Council Conclusions in the Improvement on Cardiovascular Health in the European Union. This is how you can also find it. It is a publicly available document. I do see it as a comprehensive opportunity right now for also policymakers, but also patient representations and civil society to use these council conclusions to let it actually be a useful document for once. Let's get into the basics. What are council conclusions in general? This is not something that, as far as I remember, is actually educated in universities, but if it was, it is something that I actually learned how it is built up during this presidency time. The Council conclusions is an official political statement which is adopted by consensus all EU member states. That means that all of the countries that were accepting this document accepted every word of it. They actually made a commitment in implementing it. It is reflecting a shared political commitment, but it is important to highlight that it is not a binding law. This is not something that can be sanctions if a country or the European Commission decides not to implement what is included in the papers, but it is more of a political pressure that can be used here. It is also setting directions for future policies and programs and funding and cooperation. It's basically a map. And it also offers the civil society organizations a very solid point of reference for how to engage, how to advocate for it, and what kind of partnerships and how can these partnerships can be further built. I will get into that a little bit more detail later. Why are these council conclusions are actually important right now? Why are we here? These council conclusions raise a political profile of cardiovascular diseases across the European Union. It actually brought it up to the highest of attention during our presidency. These established the common priorities in prevention, care, rehabilitation, innovation, secondary prevention. Everything what this was needed here was included in the council conclusions. I want to highlight that this was actually not just written by me. It was not written by our government. It was written together with the civil society. ESC was a fantastic help in pointing out what is actually missing, what should be done, and where should we put the highlighting points, what should be done better for now. So this is a common result. The conclusions can also influence the EU funding programs, such as the EU for Health or Horizon Europe. But right now, of course, that is in the hands of the financial ministers, how they are going to go about it next year. They also provide a shared language because it is very important to use and acknowledge this shared language that is included in the conclusions, because this is that can be used when dialoguing and talking with governments, health authorities, or other funders, because it was not an easy task to agree on each and every word in the conclusions, but every member state and the Commission also agreed to it. When it comes to health, there has to be a little bit of clearing up how it actually works. I know most of you are, of course, very much aware how it works from a legal point of view, but it is always better to repeat it. The legal competence of health remains in the hands of the member states. According to Article 168 of the Treaty of the Functioning of the European Union, the EU supports and complements these national actions, but does not replace it, and it is still a member state responsibility to provide these health services. It also ensures the health protection across all policies. It's a kind of small One Health. What is the practical meaning of this? The EU can drive strategies and frameworks and cooperations and funding, but what remains essential here is the national implementation. So your point of view and your point of contact is, first of all, always the government of your national point. The civil society can therefore engage both at EU level, meaning the Commission, or the national levels to promote a full use of these conclusions recommendations. Let's focus on the conclusion itself. During the Hungarian presidency, we wanted to create a document that is going to be impactful, that is going to make a change, even if it's not a legal document, even if it's just policy making. We aimed for a full life approach in cardiovascular health. That means promotion, prevention, where we wanted to encourage healthier environments and behaviors, all is very much in detail listed in the document. Screening and early detection, very important as well, to identify the risks and diseases early. When it's too late and treatment is needed, we need to ensure that effective and timely care is provided to those at risk or even already being a patient. Rehabilitation and secondary prevention, which is so often forgotten, unfortunately, to support full recovery of the patients and also preventing the reoccurrence of these cardiovascular events. And innovation, of course, we could never have a council conclusion without highlighting the importance of innovation. That means integrating AI, whether we like it or not. AI is taking over most of our technical tools, telemedicine, and personalized care to improve health outcomes. We wanted to put a strong emphasis on equity. That means that we wanted to leave no community, age group, or patient behind. All access needs to be provided in all of the member states without difference being given. Someone is in Belgium or in Romania, or the western side of the country or the eastern side of the country. It's a dream, but we are working towards it. What were the key challenges that we highlighted in these conclusions? There are more of them, naturally, but I wanted to highlight a few of them that I felt were very important. That we acknowledged and considered that there is persistent inequalities between and within member states. As I have already said, there is unequal access. Gender disparities, that was already highlighted by Aoife. Women are often underdiagnosed and undertreated. We still consider cardiovascular health as a men's disease. That this kind of thinking needs to be changed, and better understanding of the effects of women needs to be educated. The environmental risk factors were also taken into account. Pollution, noise, climate change, those are all impacting cardiovascular health, whether we experience it right now or not. The behavioral risk factors or modifiable risk factors were also included: unhealthy diet, tobacco use, or physical inactivity, and harmful alcohols. The list goes on. And what is more so very important is the economic burden of it all. The cardiovascular diseases are costing not only for treatment, but also the loss of productivity, and countries are paying the price for that at the moment. Let's get back into the conclusion itself for the document. There are a few parts on how to read such a document. There is the first part, introduction, welcoming, recalling, that is listing the previous EU and WHO initiatives, what was done, what should be highlighted, what to take into account, so that we don't repeat ourselves. If something was done, fine, then we need to make it better or start new initiatives. There is a part which is the considerations. The considerations are actually the longest part right now in the conclusions, I think at least half of it, because there are so many things to consider. The scale of the CVD burden, the health systems gap, the gender disparities, the social and environmental determinants, and so on. And then the last few pages of the document is basically the invitations. There is recommendations and invitations to the European Commission and also to the member states. Usually there is a part in other council conclusions that is listing for both, but in this example, during the negotiations, we recognize that it was unnecessary and the tasks division was clear. So let me get into the considerations and why are they actually so important and why are they the longest part of the document. These are actually the points where the problems are officially recognized by all member states. The inequalities in prevention, the lack of consistency in early diagnosis, the need for comprehensive rehabilitation services, just to say a few examples. So the civil society side can reference these considerations because these are, as I said, agreed language. These can be used for raising public awareness, not necessarily about the council conclusions, but I'm very happy if the public also knows about it, but just about the problem, just about what was invited to the commission, what is there for the member states. Also very useful for dialoguing for policymakers. Policymakers know exactly how to communicate about this, and they know the shared language of this they are supposed to. And also very important for applying for project support. Usually, in this document, the invitation to the member states is listed first, but I wanted to come first to the European Commission part. And why? The point that made or break these council conclusions was the European Cardiovascular Health Action Plan. We had a very difficult situation when we were negotiating this. There was the elections of the European Parliament, which meant also a new commission is going to be set. Nobody knew who is going to be the new health commissioner. And also, because of this, when we were negotiating the conclusions, the Commission was also in a very difficult situation because how could they commit to a cardiovascular health action plan because when they don't know who is going to be the new commissioner, what is going to be the direction of this commissioner? Well, the stars aligned, thankfully. And during the Hungarian presidency, the Hungarian commissioner was chosen to be the health commissioner, Oliver Várhelyi, and he took it upon himself already on the 3rd of December in 2024, even before the adoption was actually done. The member states haven't voted for the council conclusions officially. Oliver Várhelyi commissioner has already endorsed the council conclusions and the European Cardiovascular Health Action Plan. This was a milestone. This was the moment that made our council conclusions actually matter. This is also a point of reference for the civil society. We also asked the Commission to promote and collect the best practices across the European Union on prevention, treatment, rehabilitation, and screening. Also in enhancing data collection and registry separately for cardiovascular health, also in connection with the European Health Data Space. And also to support research and innovation such as personalized medicine, AI-based diagnostics, or telehealthcare services. And now come the member states. For the member states, what we invited them to do is to develop or update their cardiovascular health strategies. There are member states who do have a cardiovascular strategy and member states who do not. They can choose whichever they would like to do. Expanding early detection programs, for example, regular cardiovascular screenings into the public health programs, promoting health literacy and public awareness, which cannot be highlighted enough. Strengthening secondary prevention and rehabilitation services, which is lacking behind sometimes and easily forgotten. Addressing socioeconomic inequalities in health outcomes, which is a holistic question, of course, because that matters to all, not only cardiovascular health, but all health questions. Reducing environmental factors affecting cardiovascular health and facilitate the use of innovation, which cannot be highlighted enough either. For the civic society, it is also an opportunity to engage on these questions with national health ministries and agencies. Ask them what is their plan in implementing these questions. They might not know that because, of course, we only accepted it half a year ago. It's only the end of the Polish presidency, but it does help to keep them in the loop that this is still existing. Encourage the development of funding of national strategies because that is going to be always a question for them. Are they going to have enough money for that? Are they going to make it a priority? If they receive the pressure, they may think about it differently, but then again, it's also in the hands of the member states. And the most important part is to offer the patient perspective and also your expertise. That is a knowledge that is unfortunately not always available to national governments. So, how can the Civil Society use the conclusions? I have already given you a couple of hints, but just to give you a list as well, to reference these conclusions in national advocacy and dialogue, because again, this is on the table of every health minister, or at least in the drawer. To encourage the governments to act on the agreed invitations because they all accepted it. To contribute shaping the EU-level initiatives, such as the European Cardiovascular Health Plan. I do not have official information when the first draft, the European Cardiovascular Health Plan, is going to come out, but now is the time to ask for a seat at the table that is going to decide how it is going to look like. We gave a map, and now it's up to the Commission and for you on how it is going to be implemented. And to collaborate across borders, to share best practices and strengthen patient voice, because the community itself is going to be the most important part in this. So just to give my final takeaways, I do believe and I hope with all my heart, pun intended, the 2024 conclusions mark a turning point for cardiovascular health in the EU. And how we wanted to build it up is to offer a strong and united political commitment from all the EU member states, but the implementation remains key. The civil society organizations do have an opportunity to ensure that no community is left behind. You know it better than we do in the fight against cardiovascular diseases. And by working together, and this is my final message, I hope that we can turn this political promise into healthier lives for millions of people in the European Union. Thank you very much.
Wow, Kitty, thank you so much. Very clear. I think everyone can understand it, but also what is very important, packed with tangible actions. And I think I hope, and I hope my colleagues on the panel hope as well, that with that explanation, there will be a lot of movement among our community empowered to take action. I wanted to very quickly catch up on some points you've mentioned, and as well the dynamics in the chat. You did mention about the role of national governments. This is why we have this call, to empower our members on the national level. You also mentioned funding. How important it is that we build into those strategies the funding streams, so on a national level. And we will have Joanna who will help us understand how we can influence it. But also, you've proudly shared about different aspects and different points mentioned in the council conclusions. And I take this opportunity because from the FH Europe Foundation community perspective, it's the first time where we have spelled out very clearly familial hypercholesterolemia and elevated lipoprotein A, as well as early screening, early detection, and prevention. To Aoife's point, we talk about early as in early in childhood. So I think our community cannot miss out on an opportunity like that. But also considering that each has got so many members, if I mentioned 21 21 different organizations, we also have stroke. You've mentioned about the importance of rehabilitation that the stroke community is advocating for, secondary prevention. So I think everyone will find something in there. And one other thing I wanted to mention, and it is in the council conclusions, is the rare CVDs, the rare diseases. And I think we should, in those big numbers, never ever forget that within the CVD community, we also have people with rare CVDs. Just FH Europe, we have 2 of those, but within each, we have dedicated patient groups that advocate on behalf of people with rare CVDs. So I think it's extremely important to emphasize that there is really, this is a very comprehensive document.
We did want to include as much as possible the rare diseases as well, and those who may have been lagging behind or forgotten, so that when we are talking about rare diseases, they can also look at these conclusions. When we are talking about bigger diseases such as diabetes or chronic kidney diseases, everyone can reach for this document and they can use it with their national governments, because I can not say it by heart which points are including this. But for those who actually find one of those diseases very important, just look for it in the council conclusions, go for your national government and point out, hey, in point 14, there was a commitment from your member state and all of the member states that you are going to do this. What's the plan, for example?
Fantastic. Fantastic. This is extremely helpful. And just to catch up on what's happening in the chat, I wanted to say, guys, there are a lot of very helpful links. You have links to the European Society of Cardiology Atlas, which helps you understand the differences between countries and equity that Aoife mentioned earlier. Very good document. Mehite has put in there as well a toolkit for patient advocacy. So again, we will be sharing those materials in a follow-up email. And as we are approaching, we're way past half time of this webinar, it gives me a lot of pleasure to bring now Joanna from Global Heart Hub, who with her group has not wasted any minute. They actually activated the global community and gave them specific actions to specific instructions to take actions following some of the good examples from each. Joanna, I invite you to take the floor and help us understand what you guys did.
Absolutely. Thank you so much for that, Magda. And I've just shared my screen there, and I'm just going to share a few slides today. First, I want to thank you and FH Europe and EACH for having me on this webinar. I'm so delighted to be here. My name is Joanna, of course, and I work with Global Heart Hub. Kitty and Aoife already did such a great job explaining the urgency of this issue and the impact these conclusions could have on cardiovascular health. What I want to focus on is how advocates can respond to these opportunities, especially from the perspective of the cardiovascular patient community in the EU. So just quickly, for anyone who may not know, Global Heart Hub is an alliance of cardiovascular disease patient organizations and advocates around the world. And we are lucky to have an incredibly strong network in Europe. We have over 65 patient organizations in the EU who are all dedicated to centering the patient experience and using it to affect change. I'm delighted to see a few of our affiliates on this call today, so hello to you all. And our goal is to bring these patient organizations together with a united voice. So that means supporting their local work however we can, while also helping to amplify the patient voice on a regional level, so in this case at the EU level. And we try to do this by staying closely connected with our patient community, listening to them, learning from them, and by providing advocacy and engagement support and opportunities that can help them strengthen their voice and the opportunities they have access to. So really, what I'm trying to say is that within this network, we are trying to make sure that the voices of patients across the EU are represented and that their needs are being heard. So we all know how important it is to have stakeholders at the table and have everyone coming together. But I just want to underline how vital the patient voice is, and that Global Heart Hub is here to help make that happen by offering support to our affiliates whenever we can. So as Kitty already covered, the EU Council conclusions are at a really pivotal point. There is a plan coming together for cardiovascular health, which is such a momentous step forward. It's incredibly exciting for all of us to see, but it's not enough just for a plan to exist. We need real investment behind it. And that investment won't just matter at the EU level, it will ripple out and affect every individual member state down to people's communities, neighborhoods, and the patient communities they're there to serve. So it will give heart disease the urgency and the focus that it needs for real change to happen. So one of the key calls to action right now is for advocates to contact their national ministers of finance. And that's because discussions around the next round of EU funding is starting soon, like in a matter of weeks. And these ministers are in a position to support EU-level investment in cardiovascular health. And that investment would mean better care, more awareness, and better access for people in every country across the EU. And I really can't emphasize enough how important of a call to action this is. So done right, it will translate into significant funding for cardiovascular health. And that kind of funding could set us on a new path forward to better, more responsive, and more proactive care, which of course means lives saved. So action and funding at the EU level will also motivate similar action at the national level, because that kind of pressure is what can push national level policymakers to either have or update their national CV health strategies, and of course, to put dedicated funding behind it. And that is going to open up more opportunities for the patient voice and, of course, for improvements to happen. So it is all connected and it all matters. And of course, we do want and need as many voices across the EU as possible to do this. But I'm very excited specifically for this opportunity for patient voices to be heard, to be part of this process, because it is a way to make sure their needs are being met and that they're recognized as key stakeholders. So we just don't want to let this opportunity pass us by. I want to highlight again that we do need as much action as possible if we're going to see this funding come through. And what we do now is really going to determine the outcome. So if it seems like a small thing to write a letter, I'd really encourage you to take another look at it because it really is momentous. But I also do want to recognize that advocacy can sometimes feel overwhelming. Even sending a letter or an email or even social media can feel a little, where do I start? Am I really in a position to advocate for this? Do I know enough? You might feel like you need a certain background, a certain level of training, a certain amount of secret access, but that's not really what being an advocate means. You don't need to know all the ins and outs of EU policy. Frankly, nobody really does. And of course, it is important to be educated, to be on webinars like this, to learn about what's going on. But what really matters is using your voice to speak up about what you do know and why it's important. Now, I also want to emphasize that if you're coming from a national or local community, your voice matters to your national policymakers because policymakers care about what their constituents think. If they're hearing from the people that's going to be voting for them or for their party or paying attention to their government, that's who they're going to be wanting to hear from because they know that they're accountable to you. So there's no one better suited to speak up and ask for what you need. Now, we have been very lucky. We have a wonderful patient network across the EU, and we have already seen that patient organizations and advocates in our community are stepping up to answer this call. So I've got a few screenshots here, but basically we are seeing patient organizations reaching out to their finance ministers in countries like Germany, Greece, Austria, Spain, Italy, and more. And we've just seen such an incredible impact from this, even though it's only started in the last couple of weeks. And to illustrate how powerful this can be, we were also very proud to have our operations manager, David Kelly from Global Heart Hub, who is also a heart valve disease patient, speak at the MEP Heart Group launch event a little while ago. The moderator of the event later said that his story was one of the most powerful testimonies she'd ever heard, and it had a real impact on the MEPs in the room. So it's a driving force behind why they want to take action. So again, for patient communities and all advocates, we need to seize this moment and have as many voices as possible to show how urgent the support for cardiovascular investment really is. The last couple things I'd like to say, Global Heart Hub is committed to making sure our community has the support they need to take action. So this means we want to provide guidance and tools, of course, but also that we are here as people to answer your questions, provide encouragement, and support and advise whenever possible. The European Society of Cardiology and the EACH Alliance have already done amazing work in creating templates for the letters to the Ministers of Finance, so those resources are ready and available. And Global Heart Hub has also put together a list of relevant Ministers of Finance across the EU, along with their contact details. So really, the first steps are already laid out and hopefully easy to follow. But we're also here to keep supporting the community however we can, whether that's answering your emails, offering your help, amplifying your advocacy on social media. Every message, every conversation, it all adds up and makes a difference. And right now, we're going to be looking at these letters to the Ministers of Finance, but I'm sure there will be much more to come, and Global Heart Hub will be here for it all. Finally, I just want to thank FH Europe and EACH again for having me here, and thank you everyone on the webinar for being here and for caring about this. If you are from the patient community and you're looking for more support, my email is up on screen. There's also a QR code that would link to a short form you could fill out. That's specifically for patient groups, but anyone who's looking for additional help is welcome to reach out. Thank you again, and I'll hand it back to Magda.
Wonderful. Thank you so much, Joanna. And I think what we all need to take away from that everybody has got a role to play. Every single experience, set of knowledge matters. And they might be used slightly differently in different countries depending on the specific organization you represent. Joanna has just now presented a patient organization, but if you are from a national society, whether it is a national cardiology society or atherosclerosis society, stroke, and others, and I don't necessarily want to name anyone because I might easily forget someone. That's not the intention. Let's remind ourselves and let's feel inspired and motivated to act, because now we have clearly the understanding of the opportunity we are faced with. We cannot miss it. We have clear understanding of what the council conclusions are in the light of the promise by the EU Commissioner that there will be a dedicated cardiovascular health plan, and also specific actions, i.e. making sure that you reach out to your governments, to your ministers of health, to make sure that whatever happens is included in the national strategy and commented onto the European plan, but also reaching out to the finance ministers to ensure that they secure funding to make it a reality, that those things can be implemented and funded. Today's webinar is a webinar on behalf of EACH, the European Alliance of Cardiovascular Health. All of us are members. Not everybody could be on this webinar, but there are other organizations, and I just want to make sure that nobody feels left behind. Each of us have received templates of letters, and it's great that Global Heart Hub has done a lot of work behind the scenes to put those lists together with contacts. Those are being disseminated across the whole alliance, as well as individually by each organization. So as a follow-up to this webinar, every participant will get those examples, those contact details, and links to the council conclusions. So make sure that you read it, disseminate it, and act. We are slightly over time now with our presentations, and I wanted to ensure that we open the floor to you guys, and I know that there are questions coming up. So I will just try to read them very quickly. One question for Kitty. What are some practical first steps a patient organization can take to engage with policymakers using the council conclusions? I think you've covered it a little bit, but maybe a brief reminder.
But I can say that it depends which member state we are talking about. Each of the governments are going to be different. This is why the European Union is a beautiful place. We are diverse. And each of the governments are going to have different priorities. Find those priorities. Find the priority that is actually most important to you. Highlight it in the conclusions. Say which numbers these are, and then write a letter. Those templates are actually very useful. However, a personal invitation or a personal meeting with any of the decision makers in the government, even from lower level, can mean a lot if you have the opportunity. So again, it depends which government you are talking to and whether you have a good connection with those who are working there, but it is always best to be kept short and precise what you need.
Fantastic. And I hope, again, people will feel inspired and empowered to do so. So now I have a question, and I would open it. How can patients ensure that their lived experience are reflected in the implementation of those policy recommendations? Maybe, Kitty, I will use your experience from working in a government. How important, how useful, how relevant is that?
It's always about the patients. I mean, when we are talking about healthcare, we tend to forget that this is not about the doctors or the nurses who are actually, of course, building up the system itself, and their work is appreciated endlessly. But the end is always the patient. The patient goes to the health system because she or he or they then need help. They need help in understanding what's going on with them. They need a treatment. They need screening. They would like to live their lives better. What patients can do here is to have a voice, have a loud voice, say the pain, say what is actually bothering you. How can my pain be smoothed better? What kind of medication can I get? What kind of care can I get here? Asking for this from governments. From governments, I'm not sure how much that's actually possible, because governments usually do not talk to patients very separately. I have had a couple of phone calls when I was working in the government where actual patients were phoning in, but as a lowly officer just sitting in my office, I couldn't do anything for that patient, no matter what kind of pain they were or she was going through at that point. But what I could tell her is to write a letter to the minister, write a letter to the state secretary, or find a patient representation group that actually can help her. The louder the voice, the more the government needs to listen.
Fantastic.
Good.
And
Would you mind if I jumped in on that, just because
please, yes.
such a great answer. And I just wanted to say one other thing that came to mind, which is when lived experience is sort of on the table and you're able to share that, if you can attach an actual recommendation. So this is my experience, this is what I have seen, this is what other people in my community have seen. So bringing in other people, other people within your organization, saying, I'm not just here on my own, I'm here because this is a common experience across our community and many people are experiencing something like this. And this is what you can do about it. And if you can make that recommendation really practical, really aligned with what you think they can accomplish, that will sort of also set you on a level playing field as a stakeholder, and that can help as well.
Thank you. And this is extremely important. However, I would like to challenge our panelists and the audience in terms of how we think about cardiovascular disease, cardiovascular health, and the council conclusions and what we're trying to achieve. I think when we stick to patients and patients only, it leaves behind the citizen and all the people who actually want to preserve their health for as long as possible. And our job is to ensure that they never become a patient. So I think everybody, again, has got a role to play, not just the patient. I think our job is to ensure that we have as few patients as possible. And Aoife was saying it at the beginning, that a lot of cardiovascular disease is preventable, and we can prevent it if the council conclusions are being used, the countries have strategies, and we act. We are slightly running out of time, and I know that there are questions from you guys. So what we will do is ask our panelists to answer to them in a written form, and we attach them to the emails. But I would like to ask Aoife, who represents today each, for one last question. Aoife, if we could accomplish one outcome as a result of this webinar, what would it be from each perspective?
I think for me, it's very much we can feel on this call the momentum for taking action for cardiovascular health. For me, momentum is built from obviously continuous action with one voice. We've been given a framework through the council conclusions, and we're hugely grateful to the Hungarian presidency for providing us with that framework. As Kitty pointed out, there was a huge amount of work that's part of this. I think my call from this would be now to be able to commit as a group to the roadmap, this call for national action, to work together in that unified voice, and to be able to work together as a community under the umbrella of the European Alliance for Cardiovascular Health. We've built momentum. We're now working and using the next few weeks, which will be essential to deliver what we're looking to deliver in terms of urgent action. So using the framework that's been given to us in terms of the council conclusions and the umbrella of the European Alliance for Cardiovascular Health to bring about the change in the coming months.
Wonderful. Thank you so much. We have officially 1 minute to go, and we'd like to end our webinars on time, but I would like to ask the audience to stay with us for a few more minutes, please. Before we go, I would like to just remind everyone that every single piece of material that was shared in a link, experiences, tools, examples of letters, the list of contacts, and you've mentioned the roadmap will be shared in the follow-up email with everyone, which we scheduled for Tuesday. In the meantime, I would like to invite my team, please, to share very quickly a very simple poll, because we want to understand from the audience whether this webinar has been useful to you. And a second question, what will you do next? So Spela, if we can still do that, fantastic. Guys, give it a second, use the Zoom function and answer. Has this webinar helped you understand council conclusions? And do you feel empowered to send a request email to your Minister of Finance, or for that matter to your Minister of Health, or take any specific action, any other actions, post something on social media asking for commitment to cardiovascular health plan on a national and European level? Please take a second to answer. And Spella, whenever you feel we can share the results, then let's share them on the screen. I would like to take as well an opportunity while you speak about it to remind everyone that we will have exactly the same webinar on June 16th, but with a slightly different set of panelists. So thank you, Aoife, for joining us. Each will be represented by Sophie Miller, but Joanna and Kitty will be joining me on June 16th. And we have the answers right now. Fantastic. So not a single no, which is great. It looks like everyone found this webinar very, very helpful. And a lot of you felt that you will take action, although there were some people who said it might be not relevant to you. I still believe that it will be empowering and maybe inspiring. I wouldn't want to forget anything, but we are 1 minute over. So there's nothing left to say then. Thank you to our wonderful panelists. You've done such a great job. I look forward to our next webinar, and thank you to the audience. Please feel free to leave any comments and words of appreciation to Kitty, Aoife, and Joanna. Thank you so much and wish you a wonderful continuation and a great start to the weekend. Thank you.